want to go into polyvagal, but I'm going to start with some Psych 101 stuff, because if you went to college, you had to have taken Psych 101, and you had to have heard, maybe even in high school, about Pavlov and those poor little dogs. But when we're taught about Pavlov and those poor little dogs, we're talking about paired stimulus, where Pavlov is trying to see what the dog will salivate to. Oh, I noticed this. Let's see if I can pair this with other things. So that's like a reward pairing, but the same can be true for fear pairings, and your brain and your partner's brain can get caught in fear pairings and seeing each other as perceived threats. Something happens, a miscommunication, a detail is left out. She gets upset. Her emotions get highly elevated. His cingulate gyrus gets overwhelmed, hits his amygdala. Now he's in fight or flight. Now he's spun up or spun down, and the other partner's like, they're now dysregulated and they go into fight or flight. And so it could be easy for your brain, just like Pavlov and the dogs, to now associate this other person as a threat or a perceived threat, or they're going to hurt me, or interactions, we can't do them and we're going to hurt each other. So we can even kind of start the conversation with everybody's central nervous system on edge, because it hasn't gone well. For 20, 30 years, it hasn't gone well. So just that anticipatory anxiety that this isn't going to go well. She's going to do this. He's going to say this. We're not going to regulate. Our central nervous systems are all over the place. And so that's another problem with the neurotypical model. Neurotypical marriage model says keep the couple in session together all the time. Don't do individual work. Like, this is the couple, keep them together. But if they're dysregulating all over your office, it's not helpful. So explain a little bit about polyvagal, because that's something that's it's been around a long time, but it's really Body Keeps the Score, and all those books are kind of bringing those in. So take us from Psych 101 to like what's happening with the polyvagal nerve.
Yeah. So there is where to start. So there are thought to be historically there are thought to be sort of two states, right? Or historically they thought that it was either the parasympathetic system or the sympathetic system that was acting, right? Parasympathetic was like rest and digest, calming down, feelings of relaxation. Sympathetic was fight or flight, freeze. And really, when polyvagal theory came, what that suggested was that it's actually much more complex than that, right? So there is, a sympathetic state. Well, I guess I should start at the top. There is the ventral vagal state, which is when the social engagement system, which is important, but the social engagement system is sort of available, and you're more calm and relaxed and better able to, regulate and interact. Then there's the sympathetic state, which is fight or flight. And then there's dorsal vagal, which is that freeze, shut down, completely overwhelmed, right? So if you think about in terms of emotion regulation, tantrums, right, or meltdowns would be more related to sympathetic state. Dorsal vagal would be more shut down, right? The blank stare, for example. And why I think it's so interesting in terms of, neurodivergent individuals is there are some differences that have been, pretty well documented now. So at baseline, there is a higher level of sympathetic activity, which means that, I wish they could see us so I could give this idea, but I guess I'll try to describe it with words. If you have a cup and your cup is, let's say, the majority of people, generalizing here, but the majority of people's cup is half full. And so let's say that the neurodivergent individual, generalizing, is 60% full or 65% full. Well, there's less that's able to be sort of, fielded and managed before it starts to feel overwhelming, right? The other thing that we know is that there is a decrease in heart rate variability, which basically just means your need to recover, like your ability to recover, right, from a dysregulated state. So you are then operating with a higher sort of like resting arousal that can lead to feeling overwhelmed. And you also struggle if you do start to become overwhelmed to recover as quickly as others. Right? So, what does this look like in a marriage? Well, it may be that the neurotypical, individual is, doesn't get overwhelmed quite as easily, or maybe they do. I mean, it varies, right? But they're able to recover quicker, right? Which then seems like, potentially the neurodiverse partner, doesn't want to repair or, is avoidant, right? When really it may just take more time before, states are then regulated and more meaningful conversation can be had. You mentioned, keep the couple in the room, right? Is like the neurotypical thing. I can tell you that I on multiple occasions have politely asked one person to leave, because in my view, getting people in a dysregulated state and then having them recreate sort of the trauma that has been, it's not helpful. I don't see it working. The other thing, just to sort of go back to polyvagal as well, is there's also this concept of blended states as well, right? So initially we went from 2 sympathetic, parasympathetic to 3 to there's actually there's a lot of variability in these states. Does that answer sort of what you were asking?
Yes, because that's 10 years ago when I kind of started doing the work, because I was seeing more and more of it happen, noticing that, hey, this kid or teen, this is probably on the spectrum. It's like, wonder how that marriage is going, right? And then I didn't even know about my own neurodiverse marriage at the time, but I was applying my neurotypical model. So I'd have the couple come in, they're sitting on the couch, and let's bring up a thing, let's do some hindsight learning or education. But this thing just happens. It's being relived, re-traumatizing for everybody. Everybody's dysregulated. So you spend 30 minutes getting people back to some kind of restful state. You've essentially just mediated a fight. Well, okay, I see your perspective and I see your perspective. Can we come to the middle? But there was no new learning, no action point. The whole thing was like this argument, a little get everybody back to their calm state, but leaving not feeling like we've done anything, but just recreated a trauma, calmed down, and we're going to do this again next week. And it was quite depressing. I did not look forward to it. I was like, this cannot be the way. We cannot, there's got to be different ways to do this. And so I hadn't learned about polyvagal and all of that stuff. So it kind of pushed me back into that and more neuroscience, because this recreating of the trauma, we know, can stick that in your brain. You can start to see this person as a threat or as an enemy or as an adversary. And I think sometimes the neurotypical person, not all people, but generally, is probably more attuned to their neurodivergent spouse is to them. And so that creates like this empathy problem in them. So I know I can feel your dysregulation. And now it's like, my empathy, I'm feeling my own things plus your things. And I may not feel like I can say my things because I'm afraid I'm going to upset you, because I'm a little more in tune with what you're feeling, whereas the neurodivergent partner is not usually in tune to what the neurotypical person is. And so it's like a data point out of the blue. Like, why are you upset that I didn't tell you the information when I asked the question? She's got 15, 20 years of this that comes forward when this thing happens, and he's operating from Occam's razor. And one data point, this is a reaction that's bigger than should be for this situation. And we get stuck in these patterns. So the education part you said is super important. And then the second part is the equipping of skills that you mentioned. And that is, what does each of us need to calm down and regulate? And some people, it might take 20, 30 minutes. Some people, it could take an hour, and it is what it is. You can't be like, in exactly 20 minutes, you will be calm and regulated. We will come and do this again. We all have different states of recovery. Mm-hmm. I use this with my clients, and I call it the Pac-Man chart. So I don't know if you, in your head, see the polyvagal chart, but usually there's a green zone. That means your active social zone. Then the next zone is your fight or flight. That's usually red or orange. And then the top is blue for freeze. And then there's like a graph over it, right? Because you can go up it and then you come down it. And then what I try to explain to the neurotypical spouse is that you said like kind of more, they're kind of on that sympathetic place right there. So on most charts, there's like a little squiggle between the green and the red, between I'm here and I'm curious and I'm engaged. And I'm like, you don't know where they are on that squiggle. And they sometimes don't know where they are on that squiggle. So a neurodiverse person gave me this great analogy, and I think it works really well with your cup. I hate these things at amusement parks, but at water parks, there are these cones, and usually they're filling up. And the whole thing, if you're a kid, you might like not knowing when the cone is going to hit you in the head. Now, I hate these on lazy rivers, because on lazy rivers, you're supposed to be relaxing and not getting a cone of water. But the neurodivergent person said to me, so here's my cone, and I don't know where I am on if the water is stress. I don't know if I'm at a little bit full, middle full, or top full throughout the day or the week. So I might come home and my wife says, did you remember to take the garbage can out? And that was the last drop of water that hit my cone, and all of my stress from today, yesterday, last week, everything I didn't process, everything I wasn't paying attention to in my body. So from her point of view, this is a big reaction to all I asked was, did you take the trash out? But again, that interoception and alexithymia, that person wasn't aware of how much stress was there. The last stressor tipped, and now she gets like all the whoosh, right? So let's change it up. How would you deal, or what would you help the neurodivergent person learn to understand? What's a equipping skill for them so they don't whoosh all of their stress on their neurotypical partner?
So one of the things is, first of all, I think when you're explaining, right, the nervous system, the light bulbs are going off, right, a lot of times. And so it can be check-ins, right? Starting the habit of a scheduled check-in with yourself, or a scheduled regulation activity. It is something that I often like for people to do, because we're not going to be, this is a learned skill, right? And so the more that we practice regulating, the more that we practice checking in with ourselves, right, in our body. I love it when I can catch somebody in sort of an elevated state, right, in session, because then I can try to understand what their experience is like for them right then, because it may not be the typical experience. But if I can get them to tell me what they can, right, about their experience currently, then those are good indicators, right, to look out for. And if we can repeat that, over time, it can be really helpful. A lot of times I've done that, and then the next week or 2 weeks, like whatever, someone comes in and they're like, I've been noticing, right? So a lot of it is just like a shifting of attention. It is what I really try to, focus on.
Okay. So I think we've kind of laid some foundation that maybe if you're a coach or a people helper, that could be clergy, chaplains, coaches, clinicians, counselors, social workers, right? If you're in that field and you have been trained and you're our age or older, you probably did not get adequate training. There is a thing that we think we can apply neurotypical models to our neurodiverse couples. That's not going to be helpful. So learning about the polyvagal system, even just a lot of stuff about neuroscience. I mean, it's a whole nother discussion on the things that are different actually in the brain and in the structure of the neurodivergent person. And also, if a wife has been in a traumatic state for a really long time, trauma alters brain functioning too. So we got two different brains and different levels of distress. And so you have to bring neuroscience into what you're doing. You just can't be like, here's an activity, go on a date and come back next week and let's see how it went. There's a lot of other stuff going on. Now, the other thing I'm really passionate about your practice is doing huge work in, and that is getting proper adult diagnosis. So I'd like to kind of go into that because aren't you working on kind of getting this done in like multiple states and kind of building this, I don't know, directory or network of adult diagnoses? So will you kind of talk a little bit about that?
Yeah. So, I sort of said at the beginning that I was doing a lot of psychological assessment. And then when I started doing more, receiving more training in the therapy side of things, I stopped doing assessment for a while. And what I realized is that there's such a need. There's just a hole, right, in terms of being able to get an adult diagnosis, and there's a lot of reasons for that I don't think we need to get into here. So basically, eventually, I was like, okay, like we got to get back to it. And so, yeah, so recently we started doing not just adults, but across the lifespan, evaluations, that can provide a rock solid diagnosis. And, as rock solid as a diagnosis can be. And, I'm really proud of the work that we're doing. And again, we're just trying to plug a hole. Right. And so, and provide people with the services that they need. So.
Now you're located in Georgia. So as a licensed professional, you are boundary to Georgia. But I was reading an email recently that there was services available outside of Georgia. So kind of, are you building a network or directory of people who can do diagnoses outside of the state of Georgia?
Yeah, well, so really it's all through my licensing, right? So
Okay.
I'm able to, in over 40 states, provide teleservices, right? And so when appropriate, and quite frankly, it's not always appropriate, but when appropriate, we would be able to provide virtual assessments as well.
Okay. So then will you please leave your website? So if people want to contact you, because that is a current thing. Like for me, if you wanted to get an assessment with me, we're 3 months out. I'm 3 months out. I'm one person. I'm trying to do a full coaching practice, write books, do podcasts. Like it's not going to happen. So I'm one little person trying to do this. So for you, they're like, okay, I just heard Dr. Sean. He says that he can do this outside of state. How would they find you?
Sure. So they can go to our website. It's www.hirtpsychology.com. It's HIRTPsychology.com.
You had to do a spelling bee on psychology. You had to really think about psychology, didn't you?
Yeah, for sure. I don't want to mess it up.
That's right.
It's being recorded.
All right. So, listeners, please reach out to Dr. Sean if you are seeking adult, specifically adult assessment is usually who people are looking for when they contact this show. And I want to remind listeners of the new resource that's just come out, Uniquely Us, Gracefully Navigating the Maze of Neurodiverse Marriage, written by my husband and I and contributing editors. Where we talk about the need for proper diagnosis. That's the whole first third of the book. Secondly, we will tell you what can change and what can't, how you're going to learn to accommodate and modify things for each other. And then the last ones I call the Tiny Tim chapters. Alas, if these things remain unchanged, you're probably going to end up in divorce or a separation because we can't go on the way that we are. We now have new information. We know better. We need to do better, as I think Maya Angelou would say. So thank you, listeners, for joining us. Thank you for being a guest on this show. And I like to remind you, I always love talking to you. Welcome back. Oh, that reminds me, listeners, Dr. Sean was on. We talked about theory of mind. So you can go back into the podcast catalog and listen to our discussion on theory of mind. So listeners, thank you for joining us. As I always tell you, there is hope for your future and you're not alone on your journey.